Hi, my name is Cassandra and I have been a registered nurse for 1 year. Dang, that time flew, y'all. It flew. Hey guys, welcome back to my channel. It's Cass. If this is your first time here, please take a moment to hit the subscribe button to join the family so that you're able to continue to be with us and grow with us. If you are returning, thank you so much for tuning in this week. This week I'm doing a highly requested video. It is a pros and cons about nursing and nursing in general. 2018 personally for me has been a year of reflection and growth, and I really realized that while I was trying to get my notes and my thoughts together for this video, because I was just like, wow, every month of this year I would think to myself like, wow, last year around this time this is what you were doing, last year around this time this is how you were feeling, last year around this time this is what was going on in your life. And I was just reflecting and I was just thinking to myself of how grateful I am of how God can have you in one space and bring you into another, and when you're in the moment you think you'll never get out of it, you'll think you'll never move forward. It's very tough, but you really have to keep pushing, keep having faith, because he truly will get you into a whole different arena. I mean, literally around this time last year, I had just passed my NCLEX around September 17th, and I was just thinking to myself like, finally I can start working. So it was just a tough, 2017 was a tough year for me because it was just one of a lot of transition. You know, you're graduating, you're starting a new job, you're moving back home or moving into your own space. And I don't think anybody really discusses what happens post-graduation. Like, yeah, you cross the stage and then what? It's a very difficult time, and that is just a whole video in itself, which I will discuss because I plan on doing a nursing series. I really want to hit on before you get to nursing school, while you're in nursing school, and then after nursing school, just to give you guys a good picture, just to discuss a lot of things that aren't discussed personally that I wish I knew, and just to open up the floor to discussion about school in general. Being in college is very tough. It's not easy. You really become a whole different person and you realize who you are, and that's just a pivotal time in life. This is where you build all of your habits, and you're not with your parents for the first time in your life, and so you really have to become an adult. Like, I would say a pre-adult, because now I'm really adulting, and y'all, adulting is a setup. It truly is a setup. But yeah, we're gonna get started on this video. So if you would like to continue and hear what I have to yammer about, then stay tuned. Okay guys, so this video doesn't really have any like specifics. I'm gonna just kind of ramble and go. I kind of want to do pros and cons, but personally me, I talk a lot. So we're gonna just get started. So the first con that I want to start with, and I'm kind of just going in order of how your career begins, is the NCLEX. You know, y'all, the NCLEX, that test is a monster. She does not deserve to be around. She's out of control. Nobody wants to be next to her. She is a mess and she will control your life. The NCLEX was a very tough time. I mean, just studying for it alone, getting ready for it, anticipating all the stuff you have to pay for to take it, all the books, you don't know where to start. It's just a hot mess. But once you pass, this is my biggest pro, guys, and this is where I like to give people hope, because once you finish, once you pass that test, that's it. You know what I'm saying? There's nothing else you have to do. I mean, of course, there's continuing education. You have to get your BLS, your ACLS, stuff like that. But that's easy. Once you finish that NCLEX, guys, I promise you, just keep sticking through, keep fighting, keep pushing, because once you finish and you pass this exam, that's it. You're a nurse. You can start your job. You can work anywhere. There's just so many outlets in nursing, and it's just amazing. But it's just that one hump you have to get over. It's a huge hump. It's a huge mountain. But once you get over that NCLEX hump and you can actually just begin your nursing career, it is a amazing blessing. So if you are at that stage in your nursing career, whether you're still in school, you're in your last semester, you're getting ready for the NCLEX, I just want to say, keep the hope alive, keep your faith, keep your strength, because it's very tough. It could be easy for others, but even if you're really book smart and you're great at taking tests, it's honestly nerve-wracking to take any type of test, you know what I'm saying, especially boards. So I would just say to keep strong, keep your faith, and just keep pushing, because once you're finished, you're really done. So yes, After that, I would say my first pro is definitely once you're done passing the NCLEX, it's just like a huge weight lifted off of your shoulders and you can really just begin life. You know what I'm saying? You can really just start life and you can start focusing on things that you really want to begin. Now, because I was not a book smart, I'm a hands-on person, okay? You get to nursing school and you realize some people are just average students. I realized I was an average student when I got to nursing school because all through my prereqs I was doing awesome, you know, A's and B's. My GPA was high. I was killing it. I've always been really like heavy into academics. Then you get into your actual program and you realize I'm not trying to make all A's. You know, C's definitely get degrees, and I felt like in nursing school, I was simply studying to get grades. So I wasn't actually studying to learn the material, which is very bothersome. But at the end of the day, if you don't get that bachelor's degree, you can't sit for your boards. So I just had to choose, you know, it's either you learn your skill while you're in nursing school or you study to pass and just teach yourself everything after you leave. I'm gonna just let you know now, I learned absolutely nothing in nursing school that has helped me in my nursing career. Hands-on is so important. When you get into the field, that's when you learn the most. I learned more in my first 3 months of orientating than I did in 2 years of nursing school. How'd that work? How? You know what I'm saying? So that's definitely a pro and a con to me. It's another pro-con situation. When you're in nursing school, honestly, some people learned, but the book can only give you so much detail. Every patient is different. No patient is alike. I know I just said that again, but I had to just really stress this because you could do something for somebody else and have to do it a completely different way for another person. Whether it's medications, dressing changes, how you get them up and out of bed, even if they had the same surgery. You know, it's very different for each person because everybody is very different. So the textbook is only going to get you so far. I would say the only thing I didn't even learn labs properly in nursing school. I learned labs when I got to the hospital and I started seeing it because you see how the hemoglobin being down affects a patient. You see how the creatinine being too high does this. You know what I'm saying? Like you start to see it, you start to get the numbers together because now I'm calling the doctors because I need medication. I'm calling the doctors because I'm suggesting this, I'm doing this. So you learn so much more in the hospital. And that to me was just a pro because I just really felt like the more you see it, the more you can become the nurse that you're supposed to be. That's definitely another pro-con situation that kind of just goes hand in hand. Nursing school versus the actual real life hospital life or any, you know, clinical setting is very different from school. Even though I actually had hours of clinical experience, which you're never gonna really see it until you're the nurse, you're taking care of your patients, and you're going through it every day. Another pro about nursing in general, not even towards me specifically, is just there's so many different specialties. I love nursing because you don't just have to stay in a hospital. You could work at an outpatient clinic, you could work at an outpatient surgery center, you could work at a school, you could work at, oh my goodness, you can work for sports teams and be the nurse there. You can work, of course, there's traveling nursing. You know, that's always fun. So you can work in several different hospitals, but you can also work at the home with patients. You can work specifically for a doctor at a doctor's office. There's just so many opportunities with nursing. There's research nursing if you just love it, but you decide, you know what, bedside's not for me. So there's so many different places you could go with nursing, and every place is a learning experience. I am a med-surg nurse. I was cross-trained as an orthopedic nurse and a GYN women's health surgical nurse. So I have seen many surgeries, many surgeries. I love it. So when I started off with ortho, I was doing knees, hips, shoulders. What else did I see? You know, obviously fractured wrist, anything broken bone related. That's what I started with on ortho last year around this time. And then I wanted to go to night shift. There was no more night shift spots available on the orthopedic floor. So then I just went up to the GYN floor, which is our sister unit. And I have been doing GYN surgeries and women's health surgeries since. Ooh, we also have a lot of gastro surgeries now, which is really cool because I have realized that your stomach is very important. Make sure you're getting your colonoscopies, make sure you are using the restroom regularly, and I mean, make sure your bowels are just in motion because honestly, anything could happen. You could just one day wake up and you can't eat, and then boom, you need an NG tube. Who wants those problems? So yeah, take that seriously. So I've seen a lot of appendicitis, you know, those come in through the ED and come up to our floor. Hemicolectomies, ileostomies, colostomies, also reversals of ileostomies, colostomies. So I mean, I've just seen a lot of stuff. And then that doesn't even include medical patients, you know, that just have comorbidities that need help. It's really just amazing. That's another pro for me personally that I'm gonna just list, is that every day is not the same, unless, you know, a patient's just been there for a long time. Sometimes you'll have a patient that'll just be on the floor for like a week or so, and they're actually at the end of their healing process. Well, not the end, but as far as like medications and antibiotics, they're finished with all of that, but we're just waiting on labs to come back and be a little bit more within normal limits. So sometimes you'll just have them there, but other than that, every day is never the same. And so that's always fun. I can't imagine going to a job where I have to do the same thing every day, which in reality, you do the same thing. There's charting, passing meds. That's like the basics of nursing. But as far as like every patient, you know, their pain is different. Labs are different. You know, I may have to do potassium for somebody today. They don't need it tomorrow because their labs are fine. So I just love that about nursing, that every day is not the same. Like, you can go in and know that you're not going to be doing the same thing. You're probably not going to see the same people, because especially on surgical floors, they get discharged within 1 to 2 days if they just had their surgery and they're doing fine, nerve blocks have worn off, and you're good to go. A con and a pro. I feel like everything with nursing is pro and con, so we're gonna just go with it this way. Obviously, I work 12-hour shifts because I work at a hospital. I work 3 12s. I love working 3 days a week. Y'all, I can't imagine. All of my friends that are like on the business spectrum, they work their 9 to 5, and I'm just like, how, Sway? How are you working 9 to 5? I cannot imagine having to get up to go to work 5 days a week. It's just inhumane, and honestly, we need to work on that together as a society. 12-hour shifts are long. They are sometimes very tough, but the thing about nursing is that once you're rolling with the shift and things are happening, the hours are just screaming on past you. They're just gone. You look up and you're like, oh my gosh, I gotta go get this medication. It was just 10 o'clock, why is it 2? So the shifts honestly fly by, but then there are also slow nights, which I know we don't like that word, but since this is a video and I'm not at work, I'm gonna say it. Sometimes there's some slow nights and you're like, I'm ready to go home. If, you know, 6 could just roll around, and that would be awesome. Day shift for me personally was a con. I did not like day shift, only because I've always been a night owl. Getting ready for work for me is also a pro and a con. It would honestly be a pro if I didn't have extensive feet issues and knee problems at such a young age. I've had these issues my entire life with my feet. I always knew I probably won't be able to nurse for a long period of time, because honestly, my knee has already started causing me lots of issues, and I've only been doing this for a year. I want to say a smooth 3 to 4 months in, my knee started acting up. Every day after every shift, when I get off, my knee is swollen. My feet are in shambles. So what I have to do, which if you guys want to see how I get ready for work and what I wear as a flat-footed nurse, because it helps, I can show you guys that as well, but it takes me a lot longer to get ready for work. Putting on scrubs is easy peasy lemon squeezy. If I didn't have to do my whole leg routine that I do to get ready for work, it would take me 5 minutes to get ready for work. But because I have to put all of my stuff on, because if I don't, I won't be able to walk for more than 2 hours, and then I work 12, so that's not gonna work. It takes me about 10 to 15 minutes to get ready because I have a lot of leg wear that I wear, and it takes forever. So honestly, it would be a pro if I didn't have my leg issues, but because I do, it's a con getting ready for work. It truly is. I get this question all the time from patients' families. As I'm doing my job, they're like, Lord, you know, I could not do this. Kudos to you for being able to like do all of this, because like I said, I deal with a lot of NG tubes, which means we have canisters full of, you know, your stomach contents. So if you are not a bodily fluid person, you may want to just scroll on past this part of the video. But like I said, we just deal with a lot of bodily fluids, and honestly, nothing bothers me. You could vomit, I'm fine. You could pee, I'm fine. You could poop, I'm good. You could bleed, I'm all right. But the minute anything oral, y'all, anything oral just sends me over the edge. Like, over the edge. When people start like hacking up phlegm, I just like spitting up phlegm. Help. removing dentures. It's like oral care. If you ask me to brush your teeth, I feel like I'll do it, but ooh, it's something about oral, just oral anything. I remember in nursing school, I've never even seen a trach in real life. Okay, guys, so take this story and go. Never seen a trach in real life. But we were doing our skills labs with a mannequin, and the teacher was explaining very descriptively about some trach stuff she'd seen in her nursing career, and I almost threw up. Like, there's just something, she was like, you know, if the patient starts coughing and their trach pops out, you need to get in there, put your finger in, grab a smaller cannula. I was like this. Enough. So no, me and trachs, we do not go well. So whatever floor trachs are on, count me out. I'm not with it. I just don't know. It's something about oral care, just teeth and everything. I cannot. Ooh. Another pro is when you're in your learning stage, especially in your early months of your career. I don't know how every hospital works. I'm with a residency program, so we get to kind of go around to every floor. Well, not every floor, but we get to go around to certain floors and see how things operate. So I got to see some surgeries in the OR. OR nursing is, just the OR in general is so cool. It's just such a nice vibe down there. You know what I'm saying? Like, everybody's real close. You got the tunes playing. The patient is relaxed. You get to like see them through every stage. So I got to like see my patient in pre-op, then I got to do their surgery with them, then I got to see them in PACU. So I was just like, girl, we're here, we're doing it. That is definitely somewhere I could see myself being. I love OR nursing. It was super, super awesome. I actually got floated to the emergency department a few weeks ago. The ED is a whole beast. ED nursing is not for clean. It's just not for me, y'all. Like, it's super fast paced. Charting is completely different from what I do. They get to just do whatever they want down there, and I have no idea. They have a doctor right there next to them, even on nights, and I'm just like, must be nice to get your orders when you don't have to call and disturb anybody. Ooh, the ED is a different place, guys. Kudos to ED nurses. Y'all are really the champions. I love y'all, because how? No, ma'am. Although I could really do without IVs and the AC, so if you could just, you know, start putting them in the forearm when you send them up to me, that would be awesome. Remember that if you're an ED nurse. I know the AC's, it's great. The vein is right there. It's a blessing. But that pump, when the patient starts bending that arm, I have to deal with the pump. Me. The beeping, the yelling. It's not fun. And then the patients be looking at me like, girl, what you gonna do? And I'm like, here's a pillow. Don't bend your arm. And don't let it be the arm that they use, like their dominant hand. They be like, can you move it? Nah, girl, I'm not about to stick you again. You just gonna have to relax with this one. It is what it is. Sorry, I had to comb my hair. Y'all saw it was getting bigger, right? Okay, I'm back. But I definitely want to just talk about my last pro for you guys, and that is getting to see someone heal. This is really why you do the job. You have so many moments where you're just like, this is why I do what I do. Nursing is such a great career if you're a caring person, if you're a loving person. I'm honestly a person, I'm not a people person. I don't really like to interact with people all the time, 24/7, but there's something about taking care of people and helping people in their vulnerable state and getting them back to a point where they feel comfortable doing things on their own that makes my heart soar. So I love my job, and getting to see someone just heal is amazing. For me, it's just, you know, I'll be there with a patient for 3 days, and you know, they'll have an NG tube, they'll be on antibiotics, they'll have all of this going on, PICC lines, you know, they're on TPN because they can't eat. It's just, you can see someone really just bedridden to a point where walking is too much because they have so much equipment surrounded about them. And then I'll be off for a few days and I'll come back and I'll see them hitting the hallways. They're smiling, the NG tube's gone, they only have one IV, they just look great, they feel great. And that's just so pleasing for me. And you know, people are just very grateful in that moment, and I too am grateful for them, because that means you can go home. And I always have to tell my patients, like, I want to see you again, I can't wait to see you, like, come visit us, but I'll just see you, you know, in Walmart or something, or out and about being healthy and looking good, because just seeing somebody just get healthy is just such a beautiful experience. And to know that you had a hand in it as well, even if it's just the smallest things, because even if it's not my patient, but Obviously, nursing takes teamwork, especially on my floor. We only have 2 nurses and a tech at night. So, you know, if pumps are going off, if meds need to be given and a nurse is in another room, I have no problem helping. We have no problem helping. That's just how nursing is. Every nurse is just great with just getting in there and hanging fluids if you need them, if you're needing help with a dressing change, needing help dropping an NG tube. So you get to kind of see everybody on the floor. And so to just see anybody grow in any way, and they're very grateful, whether it's just I got them a cup of water, they just remember you and they're like, oh, hey, how you doing? So just getting to meet people in general that are just in a place in their lives where they can't continue to do everything on their own and they need help, and you're able to get them back to point A. Like I said, it's just it's a blessing to be able to do what I do and to meet the people that I meet, whether it's staff or just patients, because you just get to see everybody is in a different walk in their life and you have a hand in it. You really do. It really is a lot of motivation, and you meet such great people. So like I said, it's a blessing. I'm glad God got me from point A to point B, because last year, not even around this time because it's right when I was about to start working, but like I just keep thinking about last year in the summer. I was just like super down, you know, like super down. Like I said, post-grad is very tough, and I definitely want to make a video addressing that as well. But he really got me through, and so I tried to be very positive during that time, even though it was a very difficult time. And of course, family and friends were very influential in that period of my life as well. So if you know someone who just graduated or who is on that path, it's a very exciting time leading up to it and walking across the stage. But after graduation is very, very tough. So be kind, be gentle. Don't be one of those friends that are just like, oh, you graduated, now you have time, let's hang out. Because maybe I don't want to hang out. You know, some people are just, they want to kind of be to themselves. It's very, very tough. So that is just my, you know, I'm getting up here and talking about that today. Post-grad is very difficult. So if you know somebody who's in it, just send them encouraging words, send them motivational text. Let them know that you're ready to be with them on their time and you're not applying pressure, because it's very, very important. I also want to say I am doing a giveaway through my Insta. So if you would just click down below, I'll link my Instagram so you guys can follow. Make sure you follow and then hit the link in my bio. I am doing a giveaway with Yord. I've done one before, so I'm doing another one. It's to win a $100 gift card / online voucher, so you can shop on their website as well. So this is her. So I'm going to link my Instagram down below. Head on over there, hit the follow button, okay? Follow, and then hit the link in my bio and enter the contest. And I believe it closes November 11th. I'll leave all the details down below. I love you guys so much. Please ask me questions down below. I love answering them as best as I can, and I will see you in the next one. Bye.